Okay, cool. So, as I'm sure you know, Intumed is a widening participation charity, started in 2020, and basically we're trying to help lots of people kind of get into medical school with a few more free kind of mentoring sessions for year 12 and year 13. And we also offer kind of free mentoring sessions that are one-on-one with like webinars and educational resources and work experience. So, you know, if you don't kind of have access to any of these things yet, I would totally recommend kind of checking out our website, finding out a little bit more. I've been making lots of UCAT resources that are on the website, which are kind of great and sort of mimic some of the things that some of the paid services offer. We have workbooks and things like that, which would really help your preparation. So who am I? I've just finished my third year at Imperial. I'm just about to start my fourth year intercalating in business management. And I've been working with Intermed for the last 2 years. And I did my UCAT in 2020, where I scored 3030 and band 1 in SJT. So situational judgment is all about ethics and real life scenarios. And there are 66 questions, 26 minutes, and 23 seconds per question, which sounds a little bit tight, but actually for UCAT standards, it's pretty generous. And you'll find that you actually do have quite a bit of time to kind of work through the questions at a bit more of a comfortable pace than some of the other previous sections. Now, before we kind of get into the rest of the slides, I don't know if any of you have kind of practiced SJT before, have are familiar with the questions. Are there anything in particular that you've noticed is particularly tricky? Maybe some areas that you've been struggling with? If you could put those in the chat, then hopefully we could address those during the session. Is there anything at all you guys have been kind of struggling with or anything like that? Any sort of themes that maybe you found have been particularly tricky? Or have you not really looked at SJT before and this might be your first introduction? You guys can still hear me? Yeah, okay, perfect. Anything at all that you guys are thinking about? No? Okay, right, let's carry on then. Oh yeah, a third person influence. So is that kind of, do you mean sometimes when people are saying, like going to somebody else and asking for advice? Yes, yeah, those ones can be quite tricky because I often find that they sort of chop and change what they want. So with those ones, I would recommend kind of, so if it's somebody who you're meant to be asking for advice, then that would always be a very appropriate thing to do. But if it's somebody who maybe is on the same level, or maybe it could be seen as gossiping, then usually that could be seen as inappropriate but not awful, because at least you're sort of getting some help. But anyway, thank you for putting that in the chat. And yeah, please do, as we go through, keep any kind of questions that you have, even if it's a bit more general, and I'll go through and answer them at the end. So yeah, to talk a little bit more about SJT, it is a little bit subjective. So the way they kind of mark it is they have a bunch of ethics questions and they get some doctors to do it. And when you kind of practice and you go through different question banks, you might find that on one platform it says one thing and on another platform it says another thing. And this can be quite confusing. And one thing I'd say is, yeah, sorry, I'll stop sharing the slides for 2 seconds, just so you can see me while I talk. With SJT, like I said, it can be a little bit subjective. And so don't get too bogged down by the little details. Understand the core principles, understand the core values, and that should hopefully guide you. They do half mark and things like that as well. So that does give you a bit more leeway. Okay, I'll continue sharing my slides. Okay, so the way the questions work are you're going to be evaluating the appropriateness and the importance of statements. So you get multiple questions per paragraph, usually about 4, and you get half marks awarded for being on the right half. And it's scored as bands 1 to 4, 1 being the highest, 4 being the lowest. Most UK medical schools really like a band 2 or above. The way I would approach a question is I didn't firstly read the scenario and read it quite thoroughly. I made sure to read all of my scenarios twice because I think it really helps you make sure you've interpreted all of the information and kind of absorbed it before you start answering the question. And you do kind of have enough time to do that. Then identify what the problem is. Usually there'll be quite a lot going on, so you want to really get to the core of like what's going on here. Then I would decide which half your statement falls in. Is it appropriate or inappropriate? Is it important or not important? And once you've kind of found the right half, then I would look for which one within that half is going to be your answer and choose your answer option. So hopefully that makes sense. So one thing I think is really important is to kind of define what we mean by each of these terms. So there are 3 types of questions that you can get. And the first type is about the appropriateness of a situation. So they will give you a scenario and they will say, how appropriate is this statement? And then you are going to choose between the 4 answer options. So the first one is very appropriate. So this is the optimal approach. It addresses a key issue in the scenario, and at least one aspect, but not necessarily all aspects of the situation, are addressed. So it does something, sorts it out really well. Appropriate but not ideal is it's not the best, but there are no negative consequences. You could do it, but it's not necessarily a very good thing to do. Inappropriate but not awful is it shouldn't be done. But if it did, it's not the end of the world. It's not good, but it has minimal potential negative consequences. And very inappropriate is it's a poor approach. There's potential negative consequences to patients or public confidence. It shouldn't happen, and it only makes the situation worse. Okay, moving on to the importance question. So this is the second type that you can get. And again, you'll get a scenario, you'll get a statement, and you have to say how important is that factor to consider when making a decision. So is it very important? So, this is absolutely essential. It cannot be dismissed. So things like patient safety, things like confidentiality, these all fall under the very important things. The next one is important. So it's not absolutely essential, it's not vital, but it could make a difference in the way you sort of approach it. Of minor importance is you can take this into account, but it doesn't matter. It's kind of mildly relevant in the decision-making process. And the way I like to think of this is something you'd keep in the back of your mind. Something that's kind of, just at the back of your mind and as you kind of approach that situation, but not really at the forefront where you might act on it. And not important at all is it should definitely not be taken into account. It's completely irrelevant, and actually to consider it would be wrong. And then the final type of question is where you rank the appropriateness. So you have 3 options based on a scenario, and you need to choose the most and the least out of those 3. So this is a bit of a newer question style, so there's not that many on question banks. And so you might not see as many before your test, but they fall under the very similar skill set to the type 1 questions. And so it's the only difference is that this is just a drag and drop instead. So as I said, that was our approach. Okay, so we're now going to go through a series of practice questions covering some of the concepts examined in the section. And as we go through, I think it will highlight some key themes that we can kind of talk about. So here is our first question. I'd like you to have a read, take your time, and then put A, B, C, or D into the chat for me. I'm going to give you a bit longer than you'd usually get, just so that you can have a good think. Okay. Let's have a little look. Sorry, because of the way the sharing works, I'm gonna have to like jump between the two. So everybody has gone for D. Okay, perfect. Excellent. Yeah, exactly. So in this situation, doing nothing is obviously a very inappropriate thing to do. You know, you've identified a potential issue. You know, he's had a drink, potentially had a drink, and that's obviously a danger to patient safety. So whenever patient safety is kind of brought into question, anything that promotes patient safety is going to be very appropriate, and anything that like doesn't acknowledge it would be very inappropriate. So yeah, well done. Okay, what about this one? Privately approach Mr. Pope and discuss your concerns. Okay, give you about 30 seconds to have a go. Okay, great. So yeah, this one is very appropriate. So A, you know, you've gone directly to the person that you have an issue with. It's done in a private manner, so there's no embarrassment. And you've kind of discussed your concerns in a way that's kind of, you know, non-confrontational and kind of addressing the issue. So you're protecting the patients, but you're also kind of preserving that sort of teamwork and that element of things as well. Okay, what about talking to Mr. Pope in front of the team? How do you guys feel about that? Okay, for this one, we've got a mixture of B's and C's. I can see why, because there can often be a bit of a kind of it can be very close between B and C. And I think that's why that kind of strategy of trying to think, is it appropriate or is it inappropriate, should kind of be the first sort of step that you take before you start deciding which specific one it is. Because, like I said, there is that blur between B and C, but you don't get half marks. You only get half marks if you're on the right side. So this one is inappropriate, but not awful. So it's inappropriate because this is a conversation that shouldn't really be had in front of the team. You know, it's something that there could be more going on behind the story. You know, not necessarily if you're wrong, but more to kind of, you know, we want to have this culture of not shaming individuals, but also making sure, obviously, our top priority is making sure that our patients are safe. But this isn't a conversation that needs to be had in front of people. That's not going to be conducive or helpful to the situation. So that's why it's inappropriate. But it's obviously, but it's not awful, because at least we've stopped this kind of this situation that could have negative consequences for our patient from happening. Okay, and the last one, tell Mrs. Francis, who is our patient. Okay, now this was a very inappropriate thing to do. Now, the reason why is telling the patient has, a lot of negative consequences in the sense of they're going to kind of completely lose trust in the profession. You're kind of, jumping the gun a little bit in talking to the patient. You're not kind of having that conversation with Mr. Pope. You don't know the full story. And you've kind of sort of done something that's going to have a lot of negative complications, and kind of an upset a patient without kind of going through the proper channels first and thinking about how you can do this in a way that is as seamless as possible. Because at the end of the day, we just want safe practice for our patient, but we also want to make sure that they still have trust in the medical profession. And finding out something like this is obviously can be quite scary, and not going to help them feel confident and help their recovery and things like that. Okay, before we do the second question, does anybody have any questions about any of those or any explanations you'd like me to repeat? And while you have a think, I just want to talk a little bit more about kind of safety. So when it comes to safety within the hospital, that's obviously our number one kind of concern, because people are coming to us in a vulnerable position and you don't want to make things worse. That's kind of the bottom line of it. So anything that's to do with sort of patient safety is always going to be very appropriate, and anything that you could think, any kind of situations that have kind of consequences for patients, you always want to think about kind of alleviating those. The second sort of aspect of it is colleague safety. So you might see questions that are like, your colleagues are stressed or overworked, or maybe they're not pulling in their weight enough. Maybe they've had like a needle stick injury. So, like maybe when they've been taking blood, they've hurt themselves. Maybe they've got, maybe they're ill, but they're still coming into work. So situations like that, where you have to get that balance of protecting your colleagues, but also protecting the patients as well. And in those situations, I'd always advise anything that's sort of local, anything that is direct, that will always be a very appropriate thing to do. Going to that person and helping to try and solve that issue. Anything that's kind of going behind their back or kind of asking people, going and telling a supervisor first before you even talk to them will always be inappropriate, but not awful. And so that's kind of that basis. And then the final aspect of safety is your own personal safety, because medicine is stressful, can be quite emotional. And so some of the questions might be to do with like burnout. It might ask you about kind of you've had an injury or you've got an illness. And anything that promotes you taking care of yourself will always be a very appropriate thing to do. So in terms of the half marking, so if you're on the right half, so if you, in the way that we're doing it today, if you put, if the answer is A and you put B, or if the answer is B and you put A, then you'll get half a mark. And then you get the full mark if you actually get the correct answer. So between A and B, you get half a mark, and between C and D, you get half a mark. So hopefully that explains it, just because I think they acknowledge how subjective the section is. And also, if on test day loads of people go for a different answer to what they've said is the correct answer, then they can, scrap the question. So whilst it is subjective and that can be quite uncomfortable, don't get too bogged down in like the little details. Try and just keep track of like the overall principles and that kind of understanding. And then another question was, how do you know when to choose inappropriate but not awful, or very inappropriate? So with very inappropriate, it will have a negative consequence directly. There's no kind of like, there's no if, buts, or maybes. It's an absolute. It definitely has kind of a negative implication. Inappropriate but not awful is almost like, oh, I can see where you're coming from, but it's just not the right way of doing it. That's the kind of way I try and understand it. I think it's important if you understand what like the terms mean, and then it makes it a bit easier to kind of choose them. Okay, so let's move back to looking at those questions. So we're going to do another appropriateness-based question. Okay, so Dr. Jones is a sexual health consultant, and one of her patients, Mrs. Young, has been diagnosed with gonorrhea, which is a sexually transmissible disease. Now, Mrs. Young has told Dr. Jones that she's still sexually active with her wife and has not told her. So how appropriate are these responses by Dr. Jones? So inform the wife about the diagnosis and tell Mrs. Young that she has done so. So I'm going to give you guys about a minute to have a think. Okay, let's have a look. Okay, we've got a mixture of things. Lots of C's, a couple of A's and D's and B's. Okay, so quite split across. Let's have a look. Okay, so the answer for this one was B. So in terms of whether it's appropriate or inappropriate, well, in this situation, we have somebody who is at risk of contracting a disease. And so telling them about it is going to be an appropriate thing to do because we have a duty as a doctor to protect people. And therefore, anything that kind of puts them in harm's way means it's an appropriate thing to do. But obviously, it's not ideal because we are doing, we're informing the wife ourselves. Now, I want to do all the questions before we talk about this because I want to kind of explain it a bit more fully. So have a go at this one. So this time we're informing the wife about the diagnosis, but this time we're not going to tell Mrs. Young that we've done that. Where would you guys put this one? Okay, good. So this one was C. So inappropriate, but not awful. So it's not awful because we have at least protected Mrs. Young's wife from potentially getting a sexually transmissible disease, or if she has it, to then go get tested and treated herself. But it's inappropriate because we haven't told Mrs. Young that we're doing it. What about doing nothing? Yeah, perfect. D, a very inappropriate thing to do. And then finally, encourage Mrs. Young to tell her wife, otherwise you will have to do so yourself. Where are you putting that? Okay, this was a very appropriate thing to do. Okay, so let's talk a little bit more about confidentiality. Okay. So in this situation, we have a patient that has a condition, and in doing so, they're putting, partaking in risky behavior, we call it, that is potentially putting somebody else in danger. So this is not just with sexually transmissible diseases. COVID is a notifiable disease, measles, things like that. So it's essentially anything that's sort of contagious, where you could be passing it on to somebody without them knowing that it's happening. And especially with sex, there's that level of consent as well that's needed. So that's kind of another factor that comes into play. But it could be with any sort of disease. With these UCAT questions, the most appropriate thing to do, like you guys correctly said, the very appropriate thing to do would be to tell this patient, look, this is the situation. It is a transmissible disease. So you're going to need to tell this person, whether it be any sexual partners, whether it's a wife or husband or whatever, or if it's maybe not a sexually transmissible disease, if it's like, I don't know, like COVID, they have to go and tell their kind of people that they've been in contact with. So you have that conversation with them and you say, look, it needs to be done. I'd like you to do it. If they say no, or you've tried and they've not done it still, then it is your responsibility to go and tell those people, because it's your duty as a doctor. If the scenario said that you've asked them already and they've come back to you and they still haven't done it, again, you go and tell people that need to be told, because sometimes they give an answer option that's like, tell them again that they need to go and tell the right people, but at that point you've already tried. With some of those options that we had, I think the kind of the trickiest one was whether we tell Mrs. Young that we're doing this or not. And we want our patients to be in the loop. We want them to make informed decisions. We don't want them to feel like we've gone behind their backs or anything like that. It's just a case of this is for other people's protection, and so it kind of has to be told. So hopefully that makes sense. If there's any questions, please pop them in the chat. And talking about confidentiality more generally. So confidentiality is one of those principles that's really key in practicing medicine, because people are coming quite vulnerable to doctors and they're talking about problems that they might not have told anybody else. And so they expect the doctor to maintain that level of privacy about it and discretion. And that makes patients feel more comfortable. And then if they feel comfortable, they open up more. They kind of talk about things that are a bit more sensitive, and that helps you as a doctor work things out and help give them a diagnosis and then be able to treat them. Confidentiality, however, can be broken in certain situations, and these are namely when that person is at risk, so for example, like a suicide risk, or if they're putting other people in danger. And that's where this kind of element of it comes in. Other sort of examples could be they may have eyesight problems, or they're having like seizures, and then we need to inform the DVLA, which is like the Driving Association, because they're not able to drive for a year. Other examples are also like to do with crimes. If someone comes and says, I'm going to commit this crime, you can then, go and break confidentiality. Whenever confidentiality is broken, it should always be done for the benefit of the patient or kind of wider society. The final sort of confidentiality example that could come up is to do with, maybe somebody has a really interesting case and you want to kind of talk about it to other people. You can do that because that's bettering people's knowledge, but you should make every effort to anonymize the information. So, get rid of names, anything that's kind of identifiable, addresses, changing details to make it so that that person maintains their privacy. Does that make sense? Does anybody have any questions on any of that? Even just a thumbs up to say that everything's okay so far. And then we can move on to the importance questions. Okay, perfect. Okay, so the next question. Dr. Smith is a GP and his next patient is 32-year-old Molly. Molly explains that she's pregnant, but she would like an abortion. Dr. Smith is a devout Christian who deeply believes that abortion is wrong. How important are the following considerations for Dr. Smith when deciding how to respond? So, Dr. Smith's own beliefs about abortion. Is that very important, important, of minor importance, not important at all? Now, I've specifically chosen questions that I thought were a bit trickier because I wanted to be able to kind of have a discussion with some of these questions and kind of explain why they might be wrong. Or yeah, I'll give you guys a minute to have a think. Okay, let's see what we got. Okay, so everybody has gone for D. Now, this was a little bit of a trick question from me, actually, because I can see where you kind of would get D from, you know, his own beliefs aren't that relevant in this situation. But actually, this goes under important. Now, you might be like, okay, why? His own opinions is pretty irrelevant. Now, when it comes to certain procedures, and to be honest, in the UK, I can only really think of abortion as a particular example. But essentially, you are allowed to practice medicine within your beliefs. So, for example, if Dr. Smith believes abortion is wrong, he doesn't need to perform any abortions. However, he should not impede on kind of like Molly's ability to access an abortion. Shouldn't, he doesn't need to explain why he thinks it. He doesn't need to make her feel any sort of way. So you can practice within the kind of the remits of your beliefs as long as it doesn't kind of affect the person that you're treating. So they should feel no shame. They should have no kind of disturbances to their treatment. They should be able to receive everything just as normal. But this kind of this consideration about his own beliefs about abortion is important because it means that he won't be doing it himself. And it is important that you kind of you can stick to your own beliefs as long as you don't stop the patient from receiving any sort of treatment. Hopefully that makes sense. Okay, so based off that, how important is it that there is another doctor available to see Molly? Okay, let me have a look at the pit. Sorry about the constant chopping and changing back and forth. Yeah, brilliant. Everybody has gone A. A little mix of A's and B's in there. Okay, so this one was A. Yeah, it's very important because, like I was saying, obviously we want, you can practice within the remits of your belief, but not in a way that's going to affect your patient in any sort of way. So if there's not another doctor available to see Molly, that's really important because we want to make sure that Molly's still receiving the care that she's entitled to. And if she wants an abortion, she should be able to have one. And that shouldn't be affected by a lack of staff or anything like that. Molly's wish to have an abortion, how important is that? Okay, perfect. This one was very important. So remember, patient autonomy and making people feel empowered of their own healthcare is the most important thing. We want to make, so medicine has shifted from maybe a paternalistic sense where the doctor was almost like in charge and making all the decisions. Now we have patient-centered care where our patients' wishes are at the center of what we do, and we want to kind of practice healthcare in a way that is according to what they want. And when it comes to kind of doing what people want, people can, over the age of 18, can refuse or like not give their consent to anything, even if it doesn't make sense to you as the doctor. So as long as they have capacity, which is the ability to make those decisions, and that's kind of seen by, can they understand what you're saying? Can they weigh it up? Can they kind of show you that they understand what you're telling them? As long as that's true, they can make a decision in whatever way they like. When it goes to under 18s, it gets a little bit more complicated, and this is where we look into things like Gillett competency, which is essentially, the doctor kind of has to use their own discretion in regards to, do they think that the patient has capacity? Do they have maturity enough to understand all of these pros and cons and consequences before coming to a decision? But in that sense, people's, even young adults and children can make decisions about their healthcare, but they can't refuse healthcare. So hopefully that makes sense. Okay, and the last one, the fact he knows that Molly's a new patient and he knows her family well. How important is this factor? Okay, this one was very important, and let's talk about that now. Okay, so for this one, we had a lot of D's and C's, and I can kind of understand why, because you're probably thinking, oh, well, just because he knows her doesn't mean, or the family doesn't mean he should give any sort of preferential treatment. One thing to remember is with these importance questions, it's not asking, so this question, it's not how important is this factor in you giving her abortion, letting her have an abortion, not letting her, but like giving the abortion or not having an abortion. It's just how important is the factor generally. So that has no kind of influence on whether it's the decision one way or another way. It's kind of looking at it from a neutral standpoint. So how important is that factor? So by that, I mean, with this one, you might be thinking, oh, well, preferential treatment and things like that. But actually, it's more from that. It's important in the sense of, if he knows somebody, even if it's not a very, like, you don't know them very well, even if you just recognize them, as a doctor, you don't want to be treating them at all because it loses that objective standpoint. And so actually, this is a very important factor, because the fact that he knows the family means that he probably shouldn't treat Molly, because when you know somebody, that kind of maybe clouds your judgment a little bit. So unless it was maybe an emergency situation and no other doctor was available, then perhaps. But so in general, if you ever see a kind of a question that was like, oh, they know the person, that fact that he knows them is a very important fact. We're not saying that it's very important in forming a decision one way or another. Hopefully that makes sense. If you want me to explain that again, let me know. So when it comes to working within your remits, this is the idea that we want to work within the limits of our kind of the limits of who we are as an individual. So the first way that this applies is between different people in the medical profession. So whenever you're doing a question, look at who you are. Because if you're a medical student, what you do is going to be very different to what you can do as a GP or as a consultant or as a junior doctor. As a medical student, you cannot practice medicine. So you're not giving treatment, you're not explaining diagnosis, you are shadowing and maybe helping with some simple things like blood, like venipuncture, so like taking bloods, or wound dressing or things like that. So, but because medical students are often dressed smartly, like a doctor, it's very easy for patients to get a bit confused. Or when they look at a medical student, they see them as part of the whole medical team because they might not fully know who they are. And so it's really important that one, as a medical student, you're identifying yourself, you're wearing a lanyard, you're making sure that patients are consenting to you being involved in their care, that families know who they're speaking to. And it's also important that you don't do anything that's sort of above your kind of training, making sure that you're comfortable with all the things that you do and not kind of confusing any patients. So that's the first way that you kind of have to work within your limits. Junior doctors, they can obviously do more, make decisions and give treatments and explain things, but anything that's like a really big decision, that should be done by the consultant in charge. So if there's ever sort of a complex situation, a junior doctor it would be very appropriate to go and tell the consultant or ask them for help than to try and sort it out themselves. Another way that we can look at working within your limits is like the example that we just saw when it comes to kind of religious beliefs. So this could be, you can have an objection to certain procedures like abortion, but you cannot have an objection to the people that you treat because that is discrimination. So any questions that you see that are discriminatory, but they might like throw in a religious kind of belief behind it, those would always be very inappropriate because they're trying to trick you a little bit. If it's an objection to a procedure, that's fine. But again, like I said, you don't want to make your patients feel any sort of way about it. You want to make sure that their treatment is, smooth and seamless. But you yourself don't have to necessarily do that procedure. So hopefully that all makes sense. Let me know in the chat if you have any questions. We'll just give a second before we do the last importance question. If you have no questions, just give me a thumbs up. So I know I've still got everybody. Okay, perfect, brilliant. Right, let's move on. So, Carrie is a final year medical student who is on her hospital placement. On her way to the ward, she notices a spillage in the lift. She's running late and has previously been shouted at for being late. How important are the following considerations for Carrie when deciding how to respond? So, the first one, that the spillage could be harmful and cause problems. How important is that? Yeah, very important. Well done. So this is something that could be a safety issue for patients, for colleagues, for anybody who's kind of going around the hospital. And so that's why it's very important. Anything to do with safety, always very important. Okay, the possibility of getting a poor grade from her supervisor, presumably because she's been late. How important is that? Okay, let's see what you guys put. I think we might have some split opinions on this one. Okay, we've got a mixture of B's and C's. So this one is correct. Sorry, C is correct, of minor importance. Now, this is because this is something that's going to be at the back of her mind. That's the way I like to think of it. So obviously, if it's, we know that the spillage could have, is an issue to patient safety. So that's our number one concern. So anything to do with that is going to be in the important section, if I'm thinking about which half I'm going to put it. So in terms of like the grand scheme of things, getting the poor grade is on the lesser of the important side, just because, remember, like, safety is always our priority. But when you're looking between the two, you're probably going to go for of minor importance, because it is still something that's a consideration. It's not completely irrelevant. It is definitely something to kind of think about. But in terms of how much it's going to influence her actions and how to respond, it's not going to have that much of an impact. And that's what kind of is that kind of concept that I want to drive home, is that these are the importance of these considerations in how to act. Whether you're acting one way or another, it doesn't matter. It's just how important is it on ultimately coming to a decision about what you're going to do. Okay, what about this one? It's not her job to deal with spills because she's just a medical student. Give you guys 30 seconds. Yeah, perfect. This was not important at all. So, anything that says sort of like just a medical student, always going to be not important. Obviously, you want to act within your limits, but we're not saying that she's going to go start like, mopping it up or doing anything herself. But it's still kind of important that she, at least notifies the right people or stuff like that. And so the fact that she's just a medical student is not important when there's things like safety, which is a collective responsibility that we all have, even if it's not her job to specifically attend to that spill. And what about the hospital safety policy on spills and leaks? How important is that? Okay, for this one, we've got a mixture of A's and B's. And so this one was actually A. So any sort of rules, legislations, paperwork, anything that's sort of like official documentation on like how to do something or how to respond to something is always going to be very important, because that's like your rule book, isn't it? That's like the exemplary guide of how to behave and like what to do. And so that's always going to be a very important thing to consider. So hopefully that one made sense. Any questions on any of those explanations, anything you'd like me to repeat so far, or any questions that you have? Okay, what are the most important factors that should be considered, and is there any particular way to rank them regardless of the situation? So there are the most important factors, I would say, are safety, confidentiality, working within your limits, professionalism, honesty and integrity. Any other ones? Yeah, I would say those are the main ones. So anything that sort of involves those kind of are always important factors to consider. The thing is, a lot of questions will encompass those kind of concepts. So within those, you need to kind of look at like the little details of like who's involved and things like that. The more questions that you expose yourselves to, the easier it will be. And whenever you get questions wrong, always like read the little explanations to kind of learn like where things are going wrong. So yeah, in those situations, I think the big three are safety, confidentiality, and like professionalism. If you always want to kind of maintain those. Any other questions that we have? But yeah, within those, you can't really rank like confidentiality isn't like more important than professionalism. In fact, a lot of them all sort of link together. So you can say that like confidentiality and like patient safety also kind of go hand in hand, because you don't want to make sure that like, you don't want anyone to be kind of exploited, or information about patients to be leaked, then that makes them feel unsafe and stuff like that. So things are all sort of interconnected in that sense. Cool. Okay, I have another question for us to look at. So this final one is a one of those ranking ones. So let me share my screen. So Misha is a first year medical student, and she has to complete her e-portfolio by the 30th of March. However, she's been very busy and not yet completed her portfolio, and only has a week until the deadline. She understands it has her professional responsibility to complete the portfolio, and it's required for her progression to second year. She's very stressed and not sure what to do. So, what is the most appropriate action and the least appropriate action that Misha should take in response to this situation? So, if you could put two letters in your in the chat in kind of one message. So like A, email her tutor and ask for advice. B, email her tutor and say she'll miss the deadline. Or C, miss the deadline. So I want your first letter to be your most appropriate and your second letter to be your least appropriate. Which combination you guys pick? Give you a minute to think. Okay, let's see what you guys have put. A and C, yeah, perfect, really well done. So this one I don't think was too tricky. The kind of obviously missing the deadline, it's not showing good professionalism. She's also not going to be able to progress to second year. So that makes it the most inappropriate thing to do. And then the most appropriate thing to do is obviously email her tutor and ask for advice. Just saying you're going to miss the deadline is not very productive. it's not, again, it's not very professional, not going to give a good impression. And so that's why that one didn't come in. Okay. So yeah, those were the answers for that one. Perfect. So just to kind of summarize some of the things that we've said, and kind of some of my top tips. So in terms of preparing for SJT, I would say don't neglect it, because, you know, it's still a definitive band. So, you know, whereas your other sections get averaged out, this one, it's very clear to kind of see what you got. And so definitely don't neglect it in your practice. But I'd also say it's probably one that you'll need less practice on in comparison to the other sections. I would read up on the GMC's Good Medical Practice Guide. So the actual guide itself is quite a long document, but there's some really good summaries out there of kind of all the key principles. So I would kind of have a read over those, just to familiarize yourself, and also like read explanations of questions and things like that. Keep practicing questions, and like I said, reading those explanations, because I think, and this kind of applies to all the sections, it's very easy to get bogged down by scores and numbers. But even at the end of the day, every practice question you do, you need to be learning something from it and taking something away, because that's how you're going to get better. Take your time, because it's the last section of the paper. You're tired, you're kind of, you know, you're a bit fatigued, you've been through a very intense test, and it is a long test. It's a 2-hour test on the computer. You know, you've been staring at a screen for a very long time. Try and go slow. That's the tip I'd give, because realistically, the check that you're going to do at the end once you've finished is probably not going to be that great. So I would try and, for the, like, when you're doing it for the first time, really take your time, really think about it, but also go with your gut and try not to overthink it too much, because I think it's very easy to sort of overcomplicate it and dilly-dally a little bit and end up making the complicated question more complicated than it needs to be. So read it, check that you fully understood it, you know, who's doing what, and then kind of choose your answer. And like I said, always decide which half your answer falls on before you choose the one answer option you think it is. And try not to compare scenarios. So with the one that we saw, with some of the examples we saw before, I feel like if you'd seen some of the ones that came after, you might go back and change your answer. And, you know, that's fine if it's sort of very obvious and you're thinking, oh no, this is miles more appropriate. But multiple situations and multiple answers can be very appropriate, for example, because when you're choosing an answer, it's not the only thing that's being done. So yeah, try not to compare the scenarios too much. And remember, within one scenario, you can have multiple things that are very appropriate to do. Perfect. So I know this was a little bit of a shorter session, but I wanted to kind of take a bit of time, since it is the last section, to ask if you guys had any questions about preparing for the UCAT in general, any questions in general about medical school, even if you had things about the other sections or about SJT, and we could just have a quick chat about those. So what resources did I use? So I used Medify. I got 1 month, and I asked my school if they would fund it for me, which they very kindly agreed to do. So definitely worth a try. I mean, no harm in asking. And so I did that. I know there's lots of different platforms out there. I'm going to be quite honest, they're all quite similar. So just kind of go for, you know, there's not really too much in it between them. And yeah, so I practiced on that for a month. And then also the actual UCAT website had 4 practice papers on there. So I did those. When I remember when I did them, some of the sections were a little bit harder than it maybe was on test day. But I still think they're the official official questions that you're getting. So a really good way to make sure you're practicing those as well. And then lots of other platforms do like little free taster packs and things like that. So I did like all of those that I could find, just to kind of get as much practice in as possible. Any other questions? How much revision would I recommend about 2 months away from the test? So yeah, I think for a lot of people, we're probably approaching maybe 1 or 2 months away from your test day. So I think it's definitely time to start of ramping up your revision. I definitely say wait till all your mocks are done. Probably, I think about this time of year, most people are. But yeah, your priority at the moment is your mocks because that's what you're going to get your predicted grades from, and they're really important with your application process. So yeah, if you still got mocks, I'd say make sure that's your focus. But yeah, once they're done and you're kind of into the summer, just try and get a really good amount of consistent practice in. It doesn't have to be a lot, but I think a little bit every day is really helpful. At this stage, I would say make sure you're only practicing timed. I don't think there's much point in practicing without a timer because I think with the UCAT, the questions aren't hard, they're just hard to do fast. So definitely practice with a timer. Um, and yeah, I mean, how much you should revise is quite tricky, but definitely try and do all of the mocks that you have access to before your test day and try and space them out a little bit. So I know some people say to save them all for the last week, but I find that a little bit too intense. I kind of did one a week. I had like, I knew I had about 8 mocks that I had, so I just did one a week in the 8 weeks towards my UCAT. I did all my preparation in a month, but that was a very intense month that I kind of did not leave my computer screen for. And I think that wasn't a very good way of doing it. So, yeah, I would say if you've got 2 months, space it out, maybe an hour or so every evening, I think should be more than enough. I did my UCAT in 2020, so it was a little while ago. But I tutor for the UCAT ever since then. So I am up to date with kind of how it works and what the tests are like. But yeah. What key math skills do we need to know for quantitative reasoning? So the general guide is that it's GCSE maths knowledge. So the majority of the test is actually percentages. So make sure you're really confident with, working out percentages of a number, percentage change, those kind of things. A lot of table-based work as well is things that I see a lot. So, being able to kind of interpret tables and things like that. Basic area formula, mean, mode, median, range, fractions, decimals. You're not going to get any sort of trig or anything like that on there. It's going to be core sort of pure maths type things where, fractions, decimals, percentages. There are tax questions, time zone questions, there's a bit of speed, distance, time, and acceleration questions in there as well. I think those are the main ones. But yeah, I think if I had to say kind of like one area to make sure that it's like really tight, I would say percentages. Because I think like maybe 30% of the test involves percentages. Any other questions? So as of your year, they've scrapped the BMAT, which means that I'm pretty sure all unis will require the UCAT then for medical school. Might be something to double check on, but I'm pretty sure. Since there's no BMAT, it will just be UCAT. And what score did I get? I got 3,030, which averages at 750 something, I think. And a band 1 in SJT. Yeah, it was. Yeah. Which section did I find hardest? I think verbal reasoning is the toughest section, personally. I think the paragraphs are quite long, and the paragraphs in my test especially were longer than what I'd ever practiced with before. Like there was points where I was like scrolling a little bit and I was like, whoa, why are these so long? And I think it's a lot to read and do quickly. I think if you gave me like, I don't know, an hour, I'd do great. But trying to do it so quickly is really tricky. The tip I'd give for verbal reasoning and what kind of helped me improve was you just don't have time to read those paragraphs. So you need to get good at skimming and then picking good keywords from your questions, finding them in the paragraphs, reading around and only reading almost like the relevant bits of the text that are going to help you get to your answer. And that definitely comes with practice. So that's kind of what I did to improve my verbal reasoning score and just practice as much as possible. The other section I found quite tricky was abstract reasoning because sometimes I do sets of questions and I would just not spot a single pattern. And that's really normal. But again, just keep practicing, familiarize yourselves with patterns. One thing that I did, which I thought was quite useful, is when I found a pattern that I was like, oh, I never would have thought of that, I would put it into a list. And then as I got closer to my test day, I kept reading over that list. And it also gave me something to do on the morning of the test, because personally, I just knew that doing questions would stress me out. So I just kind of read over my list and then went and sat the test. And abstract reasoning ended up being my best section. So yeah, I think just keep familiarizing yourself and make those lists of like unusual patterns and keep familiarizing yourself with that. How many hours would I recommend? How long is a piece of string? Because it's tricky, because some people grasp things really quickly, some people take a little bit longer. So it is really personal. I think just little and often is all I could say. I don't want to put a specific number on it, because I think that puts a bit of pressure. But yeah, a few hours a week at least. Just kind of spread it out a little bit, maybe an hour a day. Just whatever works kind of for your schedule. And then maybe kind of ramp it, and then kind of ramp it up a bit as you get closer to the exam season. Is it advisable to skip long passages and attempt short passages instead to save time in VR? Yes, I would definitely recommend that. Actually, with the entire UCAT, I would say skip difficult questions. My big mantra that I say is guess, flag, move on. If you know that a question is taking you longer than the specific allocated time that you should be taking, or you look at a question and you just go, for, I either don't get it or that's a bit long, just guess it, flag it, come back to it at the end. Because you can waste so much time doing questions that you get wrong, that you might as well have just gone a bit fast, gone through a bit faster and done questions that were a bit easier towards the end. Especially things like QR. You spend ages on like a tax question, and then you don't have time to do a quick mean question at the end, but you'd be guaranteed that mark with the mean question. So I would say, yeah, paragraphs in VR that look too long, or you just have a look at and you think, I don't really get it, move on. Because what I think with VR, my strategy was to do 3/4 of the questions well and then guess the remaining quarter. And so that meant I do have room to kind of, I will be guessing some. So I might as well guess ones that are a bit longer. But with all the other sections, you should be able to complete the questions. But if something is going to take you a little while, flag it and then come back to it at the end. What was my routine for revision? I'm not going to lie to you, it was quite a while ago, so I can't kind of give you a proper breakdown. I think I just worked through a lot of like time trials on UCAT. And for me, I get a bit bored if I do the same section all day. So I would just do like a bit of VR, a bit of DM, a bit of QR, bit of AR, SJT, and I just kind of keep cycling through them all. And then, like I said, I did like a mock a week, 8 weeks up until my exam. Any other questions? I'll keep going till 5:30 and then we'll probably end there. Anything about UCAT or university in general? What unis did I apply to? So I obviously still have the BMAT. So I applied for Cambridge and Imperial. Those are my two BMAT unis. And then I applied for Edinburgh and Newcastle. They were my UCAT unis. And then I also did Liverpool for biomed. I got offers from Imperial and Newcastle. Anything else? Anything about UCAT prep? Maybe slightly less questions about me and more questions about kind of UCAT and unis. But I was predicted, oh, I can't even remember now. 3 A stars and an A, I think. I did religious studies as my full. Why, I'm not too sure. I don't think it really helped me in any way. But I enjoyed it and I kind of didn't want to drop it. Yeah, so in terms of practicing for abstract reasoning, I think I sound like a broken record, but just doing the practice questions is really good. Timed as well. And also practice guessing, practice like doing it like you would a set of normal UCAT questions where, oh, I'm not sure what this is, I'm going to guess it, flag it, and come back to it. And abstract reasoning is one of those sections where coming back to it really does make a difference, because a fresh pair of eyes really does help. The sort of strategy I would go for with abstract reasoning is, pick out the simplest box, compare it to another box, in set A, for example, and what's similar, what's different. And once you pick a pattern, look at set B, and you should find like an opposing pattern. And I would then, the more you sort of practice that technique, the better you get at it. The more questions you expose yourself to, the more kind of the better you get at spotting them, because realistically there's only a certain number of patterns that they can have. There's always going to be the really wacky ones, like the number of right angles corresponds to the number of black shapes, and like that's something that realistically I know I'm never going to spot. But something that's like odd and even, or arrows pointing up and things like that, you kind of, the more you are exposed to, the easier it is. You can't go back to questions in another section. So your allocated VR time is specifically for verbal reasoning, for example. And then once that ends, you're on to decision making and you can't go back. But within the VR section, you can go back to whatever questions you like. So which is why I really recommend flagging any questions that you've guessed or that you're a bit unsure about. So that at the end, if you do have time, you can go back specifically. On the page, there'll be a review flagged button when you get to the end. So you can specifically go through the questions that you flagged. And I also think this is really useful in, all of the sections really, decision making, QR, abstract, where you might have guessed because you didn't spot something or you think it was going to take too long, and then you can go back at it with a fresh pair of eyes and a bit more of a relaxed timing. Okay, any final questions before we end? Okay, cool. So I guess just to kind of finish, thank you so much for attending our UCAT webinar series. I really hope it's been useful. If you do have any questions, I will share a slide with my email as you guys are leaving. Feel free to drop me an email in regards to the UCAT or any sort of help that you need with applications to university. I'm more than happy to shoot you back an email with some advice and tips. I think the UCAT sort of does mark the start of quite a long process in your application to medicine. But I remember my UCAT summer being quite tough. And that September going back being really quite busy, with personal statements and things like that. And interviews start coming in, and it's all quite a lot. But I promise you, stick at it, get through it. There's a light at the end of the tunnel. And yeah, I wish you all the best of luck with your UCAT and your further application. Yeah. If the only sort of main tip I have is just to keep practicing, take care of yourselves, look after kind of yourself during the UCAT prep season as well. And then before your test, make sure you get plenty of rest, eat a good breakfast. All your normal sort of test preparation things, I think, are key to doing well. Set yourself with a good environment and you'll do really, really well. Perfect. Thank you so much for coming. I'll just share that email as well, just in case anybody wants it. Thank you. Oh, and also a huge apologies for the delay in getting started and the kind of switching between all the platforms. Technology is not my strong suit. Oh, yes, and it has been recorded and you will be able to access the recording. I think we'll email it to you. Does anybody else still need that email, or is that all right? Okay, perfect. We'll end it there. Have a good evening.